Hello, I'm Dr. Butler. Today's video discusses topics related to vaginal health, which may be sensitive or uncomfortable for some viewers. The information provided is for educational purposes only. It is not a substitute for professional advice, diagnosis, or treatment. Please consult a qualified healthcare provider for personalized guidance regarding your vaginal health and your overall health. Viewer discretion is advised. This is an incredibly important topic that has often remained silent because of embarrassment or misunderstanding. It's time to break the silence and shine a light on what truly matters. Discussing vaginal health during menopause is not just about addressing physical discomfort. It's about preserving the quality of life, intimacy, and overall well-being. Vaginal health during the menopausal stages is crucial because declining estrogen levels trigger physical changes that can affect comfort, sexual function, and overall quality of life. The menopausal stages commonly lead to vaginal changes, including dryness, discomfort, or visible changes around the vulva, which is the outer area surrounding the vagina, and the labia minora, which is the inside of the vaginal canal. These symptoms are categorized as Genitourinary Syndrome of Menopause. Let's get into why it's important. Healthy vaginal tissue maintains elasticity, moisture, and a balanced microbiome, which protects against infections. When our body is well lubricated and the tissues are healthy, intimacy feels more comfortable and enjoyable. The vagina and the urethra shares estrogen receptors. So changes in one often affects the other, increasing the risk of urinary tract infections. Discomfort, changes in odor, or body image concerns can affect confidence, relationships, and daily activities. Now, let's get into the changes and why they occur. Estrogen normally stimulates the vaginal tissues to stay thick, elastic, and lubricated. With lower estrogen levels, the vaginal lining becomes thinner and less stretchy, leading to dryness, itching, or a burning sensation. Let's discuss physical changes in the vagina, the urethra, and the clitoris. On the vagina, there are rugal folds that are the natural ridges that help the vagina stretch. These folds may smooth out and flatten, leaving the tissue more delicate. The tissue of the urethra, which is the tube that carries the urine out of the body, can become dry and irritated. The clitoris, a small, sensitive organ above the urethral opening, may shrink. Some women may also experience clitoral phimosis or adhesions, when the clitoral hood tightens and doesn't retract to expose the clitoris easily. This can cause irritation and sexual problems. Estrogen helps maintain a healthy vaginal pH and vaginal flora, which balance the bacteria in our vagina. When estrogen drops, the vagina becomes less acidic, making it easier for harmful bacteria to grow. Let's talk about vaginal dryness. About 50% of postmenopausal women experience vaginal dryness and irritation, and 90% of these women don't seek treatment. It's common, and it needs to be shared, and it can be treated. Let's stop suffering in silence. Unlike hot flashes and other menopausal symptoms which often diminish during postmenopause, vaginal dryness persists because it stems from lasting physical changes in the vagina tissue. To help with dryness and irritation, there are non-hormonal creams or gels that can be applied. A good option is a water-based lubricant, which is preferred because it has fewer extra ingredients. This helps minimize irritation in the vulva. Popular water-based lubricants are Good Clean Health, Love Almost Naked, Liquid H2O, Yes WB, and Bio-Nude by Good Clean Love. They can be purchased online at major retailers or specialty sites for sexual wellness, pharmacies, and at Whole Food or natural grocers. Another option is hyaluronic acid. I know, what in the world is that? It is a naturally occurring substance in the body that acts as a potent hydrator and lubricant. It's found in the eyes, the skin, and the joints. It helps tissue stay moist, flexible, and cushioned, which is why it is widely used both in medical and cosmetic products. Despite having the word acid in it, it's not. It's not an acid. It's actually a gentle hydrating substance that acts like the body's internal moisturizer. The reason it's so great is its ability to attain water and retain water. A single molecule can hold up to 1,000 times of its own weight in water. Our body contains 15 grams of hyaluronic acid, with 1/3 residing in the skin. Common uses are for osteoarthritis and eye surgeries. Depending on its usage, it comes in several different forms. Now, for vaginal dryness, you can use the moisturizers I already mentioned, as well as Halo Film and KY Liquid Beads Vaginal Moisturizer. They can be purchased at Amazon, CVS, Target, specialty wellness sites such as Bonafide and Solve Wellness. There are prescribed medications as an option, such as vaginal estrogen, vaginal suppositories, or an oral serum. There are self-care options to help ease vaginal dryness. Surprisingly enough, healthcare providers recommend regular sexual activities or vaginal stimulation to help maintain blood flow and tissue health. Avoid irritants such as scented soaps, douches, perfumed wipes, or harsh cleansers that disrupts vaginal pH. Be sure to stay hydrated. And lastly, have more extended foreplay and use relaxation techniques. Vaginal discomfort is a topic not discussed due to being taboo, embarrassing, or it's just personal. But as we enter the menopausal stages, it happens because of our hormones. Earlier generations kept quiet about these natural changes out of shame, but we are better empowered when we know why and how to handle them. So let's get into this uncomfortable area of vaginal itching, burning, and odor changes due to menopause. Now remember, the lining becomes thin when our estrogen declines. Extreme dryness and thinning of the vaginal tissues can cause itching. As the tissue thins, the nerve endings become closer to the surface, making it more susceptible to irritation from friction caused by walking, clothing, or toilet paper. This irritation often results in a persistent, prickly itch. Reduced estrogen rises vaginal pH, disrupting the microbiome and increasing the risk of irritation and infections. Although vaginal itching during the menopause stages can be uncomfortable, there are various strategies to help alleviate some of these symptoms. Hormone therapy, such as a low-dose estrogen cream, ring, or tablets, can replenish vaginal moisture and improve vaginal health. Vaginal moisturizers and lubricants can be beneficial for relief. Options include the previous mentioned products and EV Soothing Vulva Cream. This is a gentle topical cream which is formulated with prescription grade hyaluronic acid, aloe, and vitamin E. It is designed to alleviate external burning, dryness, and irritation without the use of hormones. Next, opt for unscented soaps, laundry detergents, and hygiene products to minimize the potential chemical irritants. Strong scents and harsh chemicals can trigger an allergic reaction or worsen the dryness and itching. Wear cotton underwear. Cotton is breathable and it helps wick away moisture, keeping the area dry and preventing further skin irritation. Avoid synthetic fabrics as they can trap heat and moisture, creating an environment that supports bacteria and yeast growth. Vaginal burning is a deeply uncomfortable but often alarming symptom of the menopausal stages. While itching is common, a burning sensation usually indicates a more significant tissue thinning, inflammation, or nerve sensitivity. It feels intense and it can happen spontaneous, not just during sex or urination. And it can severely impact your quality of life. When estrogen levels drop low enough, the vaginal tissues do not just get dry, they become chronically inflamed. During the menopausal stages, the vaginal tissue becomes incredibly thin, pale, and raw. As the tissue thins, the protective layer over the dense network of nerves in the vagina and the vulva disappears. Because the tissue is raw, it has lost its defense barrier. Products we may have used for decades, scented laundry detergent, bubble bath, colored toilet papers, perfume soaps, can suddenly cause an intense chemical burn reaction on the vulva and inside the vagina. Treating burns typically involves a two-step process. First, we need to soothe the immediate pain, and then secondly, we need to improve our tissue health. For immediate relief, apply a cool compress or a sitz bath. For a cool compress, use a cool, not freezing, compress wrapped in a soft cloth against the vulva to numb the nerve endings and reduce inflammation. Then take a lukewarm sitz bath with plain water. Next, use a vaginal moisturizer to hydrate the tissue. Other options are hormonal therapy and self care. Follow the same steps for vaginal dryness. The last thing I want to discuss is vaginal odor. Vaginal odor during the menopausal stages is usually caused by hormonal changes that alters the vagina environment, but it can also signal infection or an irritation. This is perhaps one of the most distressing and embarrassing symptoms for us women as we go through menopause. It's a topic that is rarely discussed openly, leading to many women feeling isolated or unclean, when in reality it's a very common physiological consequence of a hormonal change. A healthy reproductive age vagina is dominated by good bacteria. This bacteria produces lactic acid, which keeps the vagina pH very low, which is like a natural disinfectant. It stops smelly, harmful bacteria from growing. Estrogen creates glycogen in the vaginal cells. Glycogen is the food source for the good bacteria. When our estrogen declines, it no longer creates glycogen and our vaginal pH rises and becomes alkaline. A more alkaline environment is a great place for anaerobic bacteria to thrive. Anaerobic bacteria breaks down proteins and releases unpredictable amines, causing an unpleasant odor. To restore the balance, we can use non-hormonal moisturizer that was mentioned earlier. Probiotics is another option, which are live microorganisms that provide health benefits when consumed and applied to the body. Probiotics help maintain balance in the body's microbiome, especially in the gut and the vagina area. They are found in foods such as yogurt, sauerkraut, kimchi, miso, and kambacha, and cottage cheese. They also come in capsules, powder, or liquid form, as well as topical products such as creams and gels. A prescribed option is a low-dose vaginal estrogen. Self-care options are avoiding douching, scented soaps, and tight synthetic clothing. Maintain hydration and a balanced nutrition to support the microbiome health. Whew, that's a lot. I know today's topic was personal, but it's common, and I hope you feel more empowered and not isolated. These are the common changes, and I hope the tips were helpful. Don't forget, Saturday starts the virtual 12 Days of Christmas Fitness Challenge. It's 12 Days of Fitness and Wellness Challenge to help kickstart your 2026 goals. Now, next week, I'll discuss supplements for hair and skin changes during the menopausal stages. Until then, take care. See you later. Bye bye.